Okay.
Okay. You ready?
Go.
Okay. Hello, my name's Judalynn. I'm a registered nurse and behavior therapist, and I'm here today with Dr. Bobritskiy. And he is going to tell us a little bit about why our babies need water and what we're missing here in the United States by not giving our children, especially infants, water. So thank you, Dr. Bobritskiy, for being able to be here with us.
My pleasure.
And can you please tell me, why is it important for babies to have water?
Well, as we know, every living creature needs water. There is no life without water. Especially for the babies, 90% of their body is water. So water participates in every single chemical reaction in the body. Water is essential for every single physiological process in the body. So by denying baby having water can cause serious health problems.
Okay, so can you describe a little bit more what those health challenges might be for our children that are not getting water?
Well, if we talked about like mothers, a lot of mothers know, for example, simple challenges such as diaper rash, baby's behavior, they cranky, they don't feel good, they don't eat good, they don't sleep good. So a lot of those symptoms or issues can be caused by simply dehydration. The main common problems such as constipation, different variants of diaper rash or any type of eczema or dermatitis, indigestion, bloating, intestinal colics. I'm sure a lot of those problems a lot of mothers face in the first months of baby's life, but there can be as serious as seizures. I had in my practice a case when mother brought 3 months old daughter who was having seizures, and doctor was going to put her on phenobarbital, which is a very powerful anti-seizure drug, and we're talking about 3 months old baby. And the first thing I noticed, her big fontanelle was concave, practically. And I said to her, how much water does your baby drink? She said, no, doctor told me, don't give her water. So I said, that's a solution. You start giving her to drink water. And it was, well, I also gave her homeopathic remedies, but she said after 3 days, no seizures, child behavior, everything, appetite was significantly improved.
So how much fluid and water should infant child up to 9 months get?
Well, in my country, we start giving water from the date of birth. And we increasing it to the point that every month should be added 100 milliliters of water. So 1 month, 100 milliliters, 2 months, 200 milliliters water per day. And water should be given in between meals, which is most of the time. For the first 3-4 months, baby's meal is the mother's meal, hopefully. But in between meals, they need to have that water, and by a year of age, they need to drink 30 ounces per day.
30 ounces per day.
Yeah, so a liter, approximately a liter, 30 ounces per day. And it's absolutely essential because it will help. Body cannot function, metabolism, biochemical reactions cannot function without water. Dehydration can cause severe impairment in the immune system, and children develop respiratory infections, ear infections more frequently if they don't drink it. Now, the notion that mother's milk is enough, and babies don't need to drink water. What about mothers who don't drink enough water?
That's right.
They are dehydrated. So if mother is dehydrated, milk is thicker, obviously babies get dehydrated. But even those mothers who drink enough water, it's still not enough. Breast milk not enough to hydrate the baby. Why all of us, we tell that we need to drink half of the weight in ounces of So why for us it's essential and for babies not? If you drink regular milk, for example, if we talk about like regular milk versus breast milk, so let's say drink milk. Milk doesn't, no, it hydrates to a certain point, but it doesn't substitute water. So if cow's milk in our life doesn't substitute water, how's breast milk will substitute water? It doesn't. So it's absolutely essential.
So why do you think that pediatricians in the United States are no longer letting their babies drink water?
Well, I can only guess. I don't know what they're coming from. I think it's just a lack of understanding of child physiology, a lack of understanding the importance of water in our metabolism. That's my guess. I'm not expert on how they think. I don't know, but the fact is that a lot of times mothers, patients who come to my office, when I ask them question, how much water does your baby drink? They said, doctor told them, don't need water. So, baby doesn't need water. So, it's very hard. I don't understand why. Because in my country, it's from the day one, you start drinking water. I know that many other countries the same way. I don't know why in the United States it's happening this way.
Fascinating. Now, what kind of water do you think babies is the best for babies?
Well, Pine water.
Pine water, yeah.
This is no obvious question. The best water that we can provide filtration system that removes all or most of all impurities, chemicals, and gives the essential minerals to the water. That water that is absorbable and give nutrients to the water, to the baby. That's the most important water. Plus, we also need to remember that water is essential of eliminating toxins and toxic waste materials out of the body. So if the baby doesn't drink the water, all those toxins circulate into the body, and that causes all kinds of neurological, digestive, immune, and many other problems.
So, we'd like to thank you for taking the time to talk to us today. And how can we get in touch with you? If people want to ask you any further questions, what's the best way for them to get in touch with you?
Well, they can call my office in my office phone number, or they can ask me questions in email, or I have a website they can go to.
And what's your website?
www.healingthroughhomeopathy.net.
www.healingthroughhomeopathy.net. Thank you, Dr. Bobritskiy, for being with us today, and we look forward to talking to you again soon.
My pleasure.
Thank you.
Very good, guys.